Today's episode is an essential conversation for anyone navigating IVF or considering it and wanting to do it with clarity, confidence, and the best possible chance of success. IVF is often presented as a purely medical process with protocols, timelines, and procedures. But what's often missing from the conversation is how much preparation and influence whole body health and internal balance truly have on outcomes. That's why I'm so excited to welcome Dr. Natasha Andreadis to the podcast. She's a highly respected IVF specialist who brings together scientific precision, clinical expertise, and a deeply integrative understanding of reproductive health. In this episode, we explore what it truly means to optimize IVF success, not just achieving a positive pregnancy test, but supporting implantation and pregnancy healthy outcomes for both mother and baby. We dive into why IVF success starts well before the cycle begins, the role of egg and sperm quality, hormones, inflammation, metabolism, and the internal environment, and how holistic and personalized approach can dramatically shift outcomes. So whether you're preparing for your first IVF cycle, navigating failed cycles, or wanting to understand how to truly support your body through IVF, this conversation is empowering, educational, and reassuring. So let's dive in. Welcome to the Holistic Health and Hormones podcast. I'm super excited to have Dr. Natasha Andreadis with us today, also known as Dr. Tash, who is a Sydney-based fertility specialist and gynaecologist with extensive experience in reproductive endocrinology, IVF, and women's hormonal health. She's a fellow of RANCOGS and holds subspecialty certifications in reproductive endocrinology and infertility, with additional training and research experience in the UK and Europe. Dr. Andreadis is known for her evidence-based and holistic approach, and she's the founder of Newtown Fertility Centre and works with City Fertility. In addition to clinical practice, Dr. Andreadis has research interests including therapeutic potential of music therapy to ease anxiety related to fertility and gynecology procedures, and has an interest in energy medicine. She's a qualified Reiki therapist and currently trained in sound healing. Dr. Tash loves to build a community, holds monthly book clubs, and she has her own podcast, The Fanny Mechanic. So let's dive deep into love to chat to you, Dr. Tash, about how we can optimize IVF success really by using a holistic approach. It sounds like you speak my language. We really love holistic, sort of approaches to improving better outcomes, especially when it comes to, such a stressful procedure such as IVF. So really just wanted to dive in and just talk about when you think of IVF success, what outcomes should couples really be aiming for in your opinion?
A live, healthy baby at term. That's what they
Yes.
should be aiming for. A
Because
single live, healthy baby at term.
I think when people think of IVF, they only think of that first thing about getting pregnant, right? Which is just that initial pregnancy test. But there's still such a long way between when they fall pregnant, from what I've seen, and then to even a healthy baby. Like miscarriage is extremely high, whether it's natural or IVF. So we have to really work on basically all of that preconception and being healthy as a couple.
Yeah, absolutely. It's about preparing the soil, really, isn't it? For
Definitely.
growing the crop. And anyone who knows anything about gardening, I mean, I spent a lot of time with my mother in her garden.
Mhm.
She doesn't just, pop the seeds in and away she goes. She spends a few months preparing the soil for growing the crops to get the best crop possible for people to enjoy at the end. So it's exactly the way fertility treatment, I feel, should run. And people shouldn't just expect to let's just go for it now. You've really got to sit down and look, analyze the soil. What does the soil look like? I get my mum's crops from last year didn't do so well. Tomatoes didn't grow as well. So then I got one of those pH meters from Bunnings and tested the soil. I said, Mum, it's missing this and that. And so we then supplemented the soil with I think it was calcium, and it was mainly calcium, which is very important for fertilization in humans as well. And then this year, great crop. She's got other issues now. She's got the possums and she's got other pests, So that's exactly the way creating babies should run, you know.
Mm,
So
yeah.
just be back and looking and observing, the basics.
Because there's a lot of people, like you said, they don't have any preparation. They may go to a doctor. The doctor says, oh, you've been trying for a year or two or even longer. Let's just go into IVF. And then they make an appointment with a fertility specialist. I mean, not like yourself, but there's many out there who there's no preparation done. They don't even ask them about supplements. There is like no, apart from a standard blood test, some of the men haven't even had a proper sperm analysis done. And then away they go. And before you know it, they've done cycle upon cycle upon cycle with possibly a positive pregnancy test, but there's been no successful live birth. And that's very
Yeah.
sad for couples who put so much emotional effort and time and they weren't given basically a lot of support from many of the some of the practitioners or specialists out there. Why do you think that is, that there's not a whole lot in the industry as a whole? There's not a whole lot of support from fertility specialists from a holistic perspective that is looking more closely at maybe stress, even men who are vaping or partners there's other things that they could tell them, look, go away, do a few of these things to get your body more healthier before coming back for a better optimized chance, I guess, of IVF outcome.
Well, I think it's because people are just in a rush these days. They
Yeah.
want quick fixes. They want it to happen now. Let's do IVF now. People are in a rush. People are not very mindful anymore. Everything has to happen very quickly and automatically. And I think a lot of fertility doctors in general, it's really hard to kind of take patients in and say, look, no, we can't actually start now. We do need to prepare the body, and that might take 3-6 months. I actually think that they find it difficult. Could that be because they're scared that they'll lose that patient to another fertility clinic?
Mm.
You know what I mean? So I think it's mindfulness, and that people they're not slowing down anymore. Everything's just so quick,
Mm.
spontaneous, and happens now. Yeah. So I think time, patience, we're missing a lot of these fundamentals.
I think as a society in whole, we're all rushed. We get married a lot later and we expect things to happen now because we have our smartphones. We expect things instantly, right? Whereas our bodies and especially our fertility and health, it's not an overnight thing, but this is a lot of the time a lead up. Would you say, from what I've seen, a lead up of all of the years and months of basically not treating your body right, maybe not getting answers earlier in your 20s, for example, undiagnosed like endo, for example, or other things. They find that out a lot later when they're starting to conceive. Then they realize, oh my gosh, there's all these things that now we have to address, and that can set them back again a couple of years.
Well, that's right. And, the later you leave it to have a baby, the more kind of toxic load you might be carrying. You might have habits that are harder to break, smoking, vaping, alcohol. So all of this can become more of a challenge. And in fact, you could say that we live in a time where we're more toxic than ever.
Mm.
So it is a constant challenge. But I really change my tune with patients. If I see them and they're approaching 35, I will say, you want to have your kids before you're 35 if you can.
Mm.
And, if that upsets you, I'm sorry, but the reality is your biology
Yeah.
tells us this. And in the IVF specialists, we're not that great at overcoming all of that. With age, especially over 35, success rates are lower. So why go against our biology? We have to be true to our biology and our bodies, and reflect on that and go, well, actually, this is the way it actually should be. And yes, the reality is, you want to have 3 kids, you're coming to me in your 20s, you got to start before you're 35, absolutely, because you've got to space out your kids ideally by a couple of years as well.
Yeah.
And it's really changing the conversation
Mm.
around a reality expectation.
Because we're getting married a lot later, or even not married, we're sort of thinking about family after we've settled down, financial, sort of security, all of that. And so people are not aware. And then they've built up bad habits. Like you said, when you sort of get later in life, you're 40, you've probably built up bad habits now for 2 decades. Or some people start off on the contraceptive pill and then once they come off it, there's many who have very irregular cycles for years because they've been on it for 2 decades, right? They expect to come off and fall pregnant like that, but it doesn't happen.
And look, that should go back onto the doctor who prescribes that pill. That doctor should actually say to that patient, look, the pill can mask underlying issues. Do consider coming off it every couple of years and spending some time off it to see what your body is doing and what it should be doing. So basically, that should be part of the consenting process, but I don't think many doctors do that. unfortunately.
No, many, I think it's many young teenagers that go in because they've got acne or even in their 20s for contraceptive purposes. And then before they know it, it's just easy. They've been on it, or even painful periods. I find the worst thing someone can advise, for people listening is if you've got painful periods and then just being on the pill to mask that. It's about really understanding the root cause of basically why you're getting painful periods. Because one day, if you want to come off it and start a family, that's not addressing why that's there. So understanding, why things are happening, even your teenage years or early 20s. But I think a lot of the male GPs, the standard GPs, they're not really understanding the female hormones as much as they should. They go in, quick fix is like, here's a script for contraceptive and off they go. There's no time to discuss side effects or long-term effects or how this should be, sort of treated, because that's not the standard practice in a lot of the standard medical education, I would say, sort of in Australia, in a Western society.
I mean, you would compare it to perhaps starting any medication, like
Mm,
a medication you would go on if you've got an immune issue,
mm,
that Humira example. I'm sure doctors spend a lot more time educating patients about the pros and cons of being on a medication like that. I doubt that people get the same information when it comes to the pill. Although you could say that we live in a society now where information is so easy to get that, and I do see this a lot more now, especially with ChatGPT. Patients are spending a lot more time talking to the internet, and they do seem more informed, and that's a very good thing.
mm.
But it shouldn't replace what the doctor should be doing as a one-on-one with that time with the patient.
Yeah, yeah, agreed. So, in your opinion, what separates a couple who conceives quickly through IVF versus couples that are struggling despite multiple cycles?
My God, that's such a big question.
Oof.
Because some patients have a lot more issues than couples have a lot more issues than some other couples.
Mm,
Couples you see, there's unexplained infertility,
yeah.
which basically means we don't really know what the cause is, but there is a cause.
Mm,
And then you've got patients where each of them has multiple issues. So it depends on the couple's baseline medical histories. And then, taking that into the laboratory, what we do in the laboratory really is not that great in terms of overcoming what's going on in normal biology. So that's why it's important to go back to preparing the body and also identifying the root cause of the problem,
yeah,
you know.
yeah.
So
And a lot of the time it hasn't been done until they've done multiple cycles, realized, okay, it's this particular issue, or we find out that it's a particular root issue. And then that sets them back another, a good 6 to 12 months sometimes if they've got autoimmune, thyroid issues, even inflammation, all sorts of other sort of diagnoses, which, yeah, wasn't addressed earlier because of missed testing or not a thorough sort of approach to really looking at the root cause prior to conception.
So is that what you see in your
Yeah, I think a lot of the time once they've done a couple of cycles and then we find out what's been going on. First of all, there's one thing which is male infertility factors, which is huge, right? Because some of them said it's all fine. And when you look at the report, it's clearly not fine. So it's been missed. Either GPs have said it's fine, even the specialist, or wasn't tested properly, right? So that's one
when
aspect.
you say tested properly, what do you mean by that?
No DNA fragmentation was done for a start, right? Even the motility, morphology, it wasn't explained. So even if you see it, they would have gone through IVF with a morphology of basically 1%, 2%, right? Which is clearly not, that's why they struggled, I guess, even with natural fertility, right? It could have been years and years of infertility or not for being able to fall pregnant. And then going through IVF as a process. And even then, the testing wasn't shown to them. They didn't even know. And then when you look at it, even male infertility was a massive factor, and that's not addressed, right? They weren't asked if they were vaping, smoking. That's one thing, right? Other things could have been endometriosis, PCOS, autoimmune. I think a lot of it is just brushed over. It's very rushed, and then the doctors just want them to move on to IVF without really addressing perhaps what is going on, even with inflammation and gut health, right? We can talk about there's so many avenues, like I said, in this sort of just health in general. Like I find optimizing your health, which is what I'm sure you agree with, is that pre-IVF health or pre-conception health, right, will influence success naturally or with IVF if it's needed.
Yeah, look, I think again, it's the doctors maybe rushing too much as well, and they feel pressure to get that patient pregnant as quickly as possible.
Mm.
And how do you change that conversation? I know that there are certain doctors that might be more thorough than others. and
Yeah.
whether they're qualified as certified fertility specialists like myself or not. I don't know if you've seen a difference there, but
Mm,
yeah. So you've also got to look at, hey, which doctor are you seeing,
yes.
and what is their approach. I always say to people, look, let's try and prepare your body and get you as healthy as possible, because ideally you want to fall pregnant naturally. You want to avoid my help if you want, if you can. You want to avoid having IVF. You absolutely do.
Yes.
Why nobody wants to go through IVF?
No,
It's
it's not
expensive,
pleasant. It's not
it's time
pleasant.
consuming, it's money. And how many people have I seen where, we've prepared them for IVF, and then, a month before IVF they fall pregnant naturally, or
Or
between
between
IVF.
cycles, or even between cycles. I've taken a break after a couple of cycles and then fallen pregnant naturally. I think the thing is, a lot of doctors are telling them based on low AMH, and we can, maybe have a quick chat. Low AMH or other factors, whether it's age. That's the first thing. The first line of, I guess, the first line of care, going to a GP will just go, okay, let's just book you in for a fertility specialist, right? Because they look at age, look at some very small factors, and go, yeah, there's no way you can, you can sort of try naturally.
Look, sometimes it's very obvious that people need IVF, and IVF
Yes.
does work for them. Tubal factor, for example, if they've got no fallopian tubes, they've had bilateral hydrosalpinges, bilateral ectopics and needing surgery. Yes, IVF was initially developed to overcome tubal factor, and that's where it can work really well. And thank God we have IVF to help
Mm,
those people. But yes, I feel that, yes, IVF is a lucrative market, isn't it? It makes a lot of companies a lot of money.
definitely.
And of course, you want it to work.
Yeah.
But yeah, fundamentally preparing the soil, and also, whether you have IVF or not, making sure that you prepare the soil adequately so that you have a live, healthy baby born at term.
That's it. Yeah. And I think it stems back not even from when you're about to start to conceive in your 20s or 30s, even comes back to, I find, education in teenage years, right? What women can do once they start, reproductive age, menarche, what they can do then to have some awareness of, okay, let's address our health and our hormones so we're able to conceive easier. And like you said, we do live in a much more toxic environment. We're more stressed, there's so much more going on with our bodies than, sort of our parents' generation or even our grandparents. But it is a lot of that sort of teenage, and you sort of just continue doing what you're doing, and there's no real education, teenage education, or even reproductive education. Now with chat GPT, that some people are still like, oh, I'm still young, we can still do all those things. And then they realize once they want to fall pregnant, there's a lot more things which is going to take a while to sort of reverse if they have, a lot of health issues. And it's two people, right? I find with conception, it's hard enough working with one person, but then you've got to get the support of both them and their partners as well.
Yeah, look, I think going back to teenagers, the most effective thing to do is to encourage them to monitor their menstrual cycles. So from my personal experience, I don't have daughters, I've got nieces. So I remember when I could see that my nieces, particularly the youngest one, was going to have her period, because I can see her body was developing. I said to her, you're going to start menstruating. I educated her about that, and then putting a positive spin on it. So when you get your period, on the first day of your period, making a little love heart in your diary to indicate that that was the first day of your period.
Mm.
So, many years later now, I can have a conversation with them and say, okay. And it's great now because they bring up their period. Oh, I'm due for a period. And how do you know that? Because, I recorded when I had my last one. Okay.
Mm.
And the other day I was having a conversation again with my niece, and she said, "Oh, my period's a little bit late." And then I went, "Okay, how many days late? And
Mm.
what would that mean? Are you eating too much? Are you gaining some weight?" Because I think that a lot of the issue now with a lot of kids is that they're spending so much time on social media and on their phones.
Mm.
Childhood obesity is increasing, and we can't ignore this. And so you put the two together. Oh, do you know that excess weight, if you gain too much weight, if you're eating too much food, that can make your periods come a bit later?
Mm.
And having those conversations with children, it's up to the parents, man. It's really
Yes.
the parents' job. It's not up to the school. Yeah, you know what? I'm sorry. I'm not a parent. Maybe this is too much for me to talk about being no parent, but I am an aunt, and
Mm.
I kind of have that exposure to children. It's up to the people at home to discuss this with the children.
Yes.
There's only so much teachers can do. It's that
Mm.
constant, okay, it's now 1st of January. Looking back the last 6 months, show me what your periods were doing.
Mm.
My mother never spoke to me about periods,
Oh no,
ever.
neither did mine. Neither did mine.
No, never. And, you know, I'm a different generation. My mom was an immigrant into this country, and, I obviously had access to information, went to med school, so I knew I got to learn more about the menstrual cycles. But just because I didn't have education in early childhood doesn't mean that I can't then change that for my nieces,
Yeah.
So I think you have children, it's up to you to educate them, and not only educating your daughters, but your sons.
Yes, I agree.
What does it mean? You're at this age now, and I know it can be a bit more tricky for the mothers to talk to their sons about, masturbation, ejaculation, all those things. And hey, if whether they have a father or not,
Yes.
you as the mother, you learn to have that discussion
Yeah.
with your child. You
Yeah.
might not be in a situation where there is a father, or there is a father that's prepared to discuss that.
Yeah.
You as the mother, that's your responsibility.
Yeah.
So workshop it, chat, chat, chat.
Yeah. Yes, I know. There's no excuses. No, that is so on point, Dr. Tash. I think it is very important. It starts with teenage years. And if they're going to have long term health and hormonal, sort of optimization and making sure they're going to be healthy through the rest of their life, it starts with having healthy hormones in your teenage years and putting that groundwork and foundation, because you're not going to be able to see everything they're doing nor control them, or but giving them the education, or at least starting them to go and be resourceful in their own way, start the conversation for them to maybe educate themselves, which is the biggest sort of power for anyone really, even as adults. I think it's that information, but what you do with it and how you put it into day-to-day practice, because we know things, we know we need to drink water, sleep earlier, not be on screens, but it's so much harder to implement for many people, right? Even if it comes to their health. Yeah, they think it's not going to make a huge difference, but it's all the little things I think we do that add up.
Yeah, and mothers also sharing openly their menstrual cycles with their daughters, making passing comments like, "Oh, I've got a bit of period pain, I think, today. I'm going to take a couple of Nurofen. Oh, I'm not feeling great today. I've got headache. I think I'm getting my period." Just openly making little comments like that to their children, or around their children, it kind of then increases the exposure for that child, doesn't it? They're automatically going to be fed this information, even by osmosis, that, "Oh, there's a thing called a period. Oh, wow, it can cause headache. Oh, it
Mm,
can cause pain." Like, this, it can be very passive, this information giving. It doesn't have to be, okay, let's sit down and have a conversation about this. You know what I mean? It's the little things,
yeah. Have
as
you
you
seen
said.
patterns with, like, if a mother was maybe struggling with infertility or had endo? Have you seen it more in their daughters? And if you look back at family history, their mum maybe would have also had, well, it was harder to, probably wasn't as prevalent as it is today. But if they were also overweight with insulin issues, do you see it in their daughters as well? I mean, are you seeing correlation between a mother's health and their female?
Yes, and you would only know that if you ask those
Mm.
questions. So, as a person who's taking a health history, you do ask about family history. Invariably, that comes up in a conversation as well. So yes, endometriosis is highly heritable. Insulin resistance, diabetes, highly heritable. So yes, always ask about family history, and not just about parents, but also siblings and cousins, first cousins, grandparents, uncles,
Yeah.
aunts, all of that.
Yeah. Yeah, which I find a lot of people aren't, well, even discussing, right? So, yeah, if you ask even your parents or even ask your mum, did you go through similar things? Or, yeah, it's usually, you'll see patterns for sure. I agree.
Yeah, like I had my last period at age 51. That was last year. I'm not officially menopausal yet, but I am approaching that. My mum and my sister both got their last period at 51.
Wow, yes.
And it's interesting, isn't it? I mean, that's the average age of the menopause overall, but that's where it's also important to ask about, "Mum, how
Yeah.
old were you when you got your last period?"
Mm,
36. 36, that's early. And that can
yeah.
that can bring up a whole conversation. That can be the reason why sometimes people see you for fertility assessment.
The
I'm
low
like, "My
AMH.
sister's period stopped really early. Could that happen for me?"
The low AMH is interesting because, yeah, that's a good point. So, if they have low AMH, especially in their early 30s, when they should be, quite healthy and be able to conceive, and then their parents have gone through, their mums have gone through perimenopause, like, or even had hysterectomies, all of that in their late 30s, yeah, it's an indication that if you want to start a family, knowing your mum history of her reproductive health is very vital to the success of your own. Yeah, your own reproductive.
Yeah, look, I saw a patient the other day who saw her naturopath, has been having a long conversation with, I call it, history with her naturopath, and not trying to conceive, but the naturopath brought up future fertility with her and said, well, look, why don't you go and get an AMH? AMH, she's in her early 30s, AMH is low, 4.4. And apparently her GP didn't think it was an issue. And I was just gobsmacked. I'm like, well, good on your naturopath for picking that up, because we're going to now talk about either egg freezing or embryo freezing for you because you're not keen on having kids right now. Or I'd like to massage that. You know, you can't really change people's lives and what they plan, and that's absolutely fair enough, you know. But have you thought about this? And that's why it's about consent as well. Before you order tests like an AMH, you do need to consent the patient and ask for permission, because if an AMH is low, I always ask them, if we do this test and it comes back as low, will that stress you out?
Yeah, I agree.
If it does stress you out, why will it stress you out? If we get this information, that we can potentially look at ways of minimizing future fertility struggles. And again, you can't just order a test with no permission.
Yeah. Yeah. That's a big thing. As soon as they see their low AMH, they are very stressed. I've got patients who've seen an AMH of 1 or between 1 and 2, and they think their life is over. And then they're doing cycle upon cycle upon cycle of IVF, because still with not a whole lot of, obviously they've come to see me after that, but they were like, I went to IVF because I had low AMH, right? And then they've just been on such a stressful, I guess, mental, emotional roller coaster, because they've been told, okay, and basically, I've got very little time left, and then they're just doing repeated cycles. And that, yeah, unfortunately can be a huge, this huge vicious cycle, in which it can affect them and help them to become even more, or make them become more stressed. And like I said, physically, mentally, emotionally, and financially, because they've got this thing in their head where my time is running out. Time is running out, right? The more they're stressed about it, the more it becomes even worse of an outcome. Yeah, and it's just
Not a lot.
Let's
Yeah.
talk about egg quality while we're on AMH. I guess, why is egg quality often the biggest determinant, and I guess embryo quality specifically, to IVF success?
Well, it's about ingredients, isn't it? So egg quality determines chromosomal competence, the way the embryo develops, and if it does develop, how it implants. So it's not about egg number, it's about egg quality, because all you need is one egg to make a baby, right? One egg. And we know that lots of things that go on in the body can impact egg quality, not just chronological age, but almost like that biological age that can be impacted by things like inflammation. So chronic inflammation is a huge factor. And inflammation in the body can be caused by many things, issues with insulin resistance, oxidative stress, and a lot of these things are impacted, nutrition, food. A lot of these things are impacted by your lifestyle, what you put in your mouth, how you sleep at night, your weight, what do you do for exercise, how often do you exercise, environmental exposures, smoking, alcohol, vaping, pollution, stress. Stress is the biggest I think stress is huge. It's a huge factor that is not, I feel, properly addressed. And again, is it because managing stress, it can be quite a difficult thing to manage stress. From my perspective, I started working with a breath coach recently, because I've had quite a number of years of stress. I've been stressed all my life, but the last 5 years were very stressful around COVID, losing my father and setting up a new practice. And so I thought to myself, I want to look at, going into the menopause. I really need to address my stress for the first time properly in my life. Anyway, I worked with a breath coach, and that was really powerful, because she not only took me through a lot of breath work exercises that helped me, but also she looked at my diet. And she could see that in the morning I'd wake up and have 2 strong soy flat whites before having any food. And she goes, that's the worst thing you can do for cortisol, for stress. Yep. And so part of me was thinking, why the hell did I need to pay this woman all this money for her to tell me something so basic that I kind of knew but didn't want to.
Yes.
Right? And so now, and there's very good evidence for that. We drink coffee, it increases
first thing in the morning. Yes.
Which then increases inflammation in the body. So it goes back to those little tweaks can make such a difference. And so doing that now, I eat properly. I then have my coffee. I then realize that throughout the day, I don't eat as much. I don't snack as much. I make better food choices.
Yeah.
And that has kind of a waterfall effect, doesn't it? So stress is a big factor. It really is, How do you
becomes a
stay?
vicious cycle. I mean, and they stress about not having the child or being diagnosed with infertility, and then they need to go through all of these procedures, testing, and it becomes a setback. So as much as we like to say not to stress, it's like I said, it's an add up of all the little things, right? Having coffee a little bit later, sleeping a little bit earlier, when your body, you can do as much as you can. Acupuncture, Reiki, all of the beautiful mindfulness thing, journaling, walking, all of that will help us to minimize that, right? I mean, we're still going to have the daily stresses, and the cortisol is the result of that. So I know even for my own clients, and it's been shown that you shouldn't be having coffee until 2 hours upon waking. That'll actually
Sleep,
prevent
that's
you from
good.
having a later coffee, because if you're waking up at say 7, not having it till sort of 9:30, you're actually helping to get through that initial spike in cortisol, but also then being able to take you through to the rest of the afternoon, perhaps, or even later in the day without needing a second or third coffee.
That's right. Yeah.
Most people, first thing they're having coffee. And I always tell people, if you find that you need coffee first thing in the morning to wake you up, you're the worst person to be drinking the coffee first thing in the morning, right? Should be having some food and then, getting everybody relaxed and having it because, yeah, it's nice. Or it's not because you wake up and you're like, oh, I can't function until I need the coffee, right? That's your body saying that, yeah, there's definitely an imbalance there. So give
Yeah.
yourself like 2 hours and not on an empty stomach for sure. Always say with breakfast or sort of after, an hour or two after you've had breakfast is
Yeah.
ideally a better time.
And also, you would hope that people don't do that in pregnancy, right? Like if you're pregnant,
Yes.
you're hopefully not going to hit yourself with 2 coffees before you have food. You can't.
No, no.
You can't do that. So then, in preparing for pregnancy, prepare with a mindset that you are already pregnant,
Yes,
and that I am now, I am pregnant. It's almost like a practice, isn't it? Practice
it
run.
is. The mindset work is a huge
Yeah, it's
huge shift
huge.
that I get clients to
Yeah.
think, right? Because if you also, when clients first come, and this is why I do the coaching that I do, I love to sort of show them that it is mindset. They come in, they feel their body's broken, it's never going to work. I'm so stressed, I'm so upset, I'm so guilty, all of those things, right? It's not going to help them get better. But like I said, visualization, mindset work is a huge part of the work that I do. It's like, yes, it's not now, but it will be very soon. What you're doing is preparing your body. Every little thing that you're doing is helping you move forward towards your goal of being a mom, right? Of being a parent. And then when you think that way, you start to be aware, I think, of everything you're doing. Is this positive or negative for my body, right? Am I eating this is going to be, going to have a better outcome? And so you start making shifts and then your body starts relaxing, because all of that stress leads to all the poor habits more so than
Mm.
not. So yeah, it's important that they are addressing the stress, which is huge because that affects also pH as well, right? If they're stressed, their body becomes highly more acidic, right? I was talking to a gentleman yesterday about having an acidic body versus alkaline, right? And disease and cancer doesn't grow in an alkaline body, but when we stress and then we're eating the wrong foods because we're tired, it makes our body highly acidic, which isn't great also for IVF outcomes also.
Yeah, and look, that's on your point about your approach to your patients. That's why I feel it is important that Western medicine practitioners like myself, if they don't have any interest in mindset, mind body connection, that they work with someone like yourself who does have that interest so that that patient can achieve their ideal outcome, because a doctor can't do it on their own. They do have to, I feel, work with other practitioners.
We
It
can't know
can't just
everything.
be them, their egos have to be stripped a little bit. And also the patients can't expect that their doctors are going to deliver all of that either. And whilst it's difficult because patients are like, oh God, you're going to send me this acupuncturist, this nutritionist, this
Mm,
and that gynecologist. That's a lot of money. But
mm.
yeah, you know what? Having a kid's expensive too.
Yeah.
And
Wait till the kid comes and then you think what you spent beforehand is expensive. Wait till they arrive.
yeah, but it's also setting you up for your own health. Start with yourself, starting with yourself, whether you are wanting to have a baby or not. When I see general gynecology patients, my approach is also the same. If I can see that they need a lot of tweaks in their general health, I will give the same advice as if they were trying to conceive. It's and if you explain that to patients, then they usually understand. But yeah, some people are just, and it's not most people are good in working with you, and they understand that it's going to take some time. It's not. It's only a few people that I see where they're like, oh no, I still, I don't believe in this 3 months of trying to prepare the soil. No, I'm just gonna, and that's fine. They can go elsewhere, and that's completely up to them. But as long as again they made an informed decision and they've been given information. And one of my bosses at RPA always used to say to me, Tash, your job as a doctor is to give people the options.
Yes.
And you outline the options, and it's up to the patient to say, okay, this is what I choose. But invariably, the patient will ask you, what would you do, doctor, if it was?
Mm.
I don't even ask or wait for patients to ask that question. I say, this is what I would do if I was you, but you make the choice.
Yeah. Yeah, exactly. And it comes down to the ideal time frame, right? I mean, if they're going to invest so much effort into having a baby, like I said, that soil is everything. So what they can do, to improve their odds is always going to be better. But like I said, it's having that live birth. It's not about just getting pregnant. It's really having a beautiful, healthy embryo, which will then implant, which will, be pregnant, but then having a healthy child. If you're going to have a child, you want it to be as healthy as possible. And it's that entire work that we're doing in this sort of optimization time frame prior to conception, which is hugely important for that outcome, whether it is through a natural conception or through IVF. It's always that preparation, right? And understanding what little things you can do. So is it better to delay IVF to optimize your health first? Obviously from the conversation, I'd say yes. What do you sort of advise clients to take that time, do whatever they can to get healthy, and then, when they're in a much better position to come back for
Yes, absolutely. And explaining them as that to them, and also giving them the support. And the support might be, yes, referrals to other practitioners. I saw a very interesting patient yesterday who's got pain with intercourse, a lot of childhood sexual abuse, and wants to be pregnant in the future. Very on board with looking at modalities to improve her general health, but also to help her overcome the vaginismus, the pain with intercourse. And very satisfying consult for me, because this person was so invested in making things better. They've been through so much trauma. It was very enlightening and I was very inspired by this patient, actually. I was just like, wow, she's amazing. She's accepted that that was her past and this is her present, and she's looking at the future now. But she even brought up, we've been talking about sound healing. And she said that she found that she really loved a sound bath. She found it very relaxing. And of course, we know that sound therapy, music therapy helps reduce stress and anxiety. And there's good science to back that up. But whether you believe in the science or not, we know that listening to music always makes us generally feel better.
Yeah.
What music we choose and what mindset we're in. So then, look, I said to her, look, maybe what you would benefit from is a one-to-one sound healing session. Not part of a sound bath where you're in a room with 20 other people, but a one-on-one session. You can cry freely, because she said, I found that when I did the sound bath, I cried. I'm like, that's actually a very good thing. This is the purpose of the sound bath, of the sound healing, is to enable the body's emotions to come up and for those emotions to be released from the body. Because as you know, being an Eastern medicine practitioner, when you hold on to those negative energies, that vibrationally does not sit well in the body. And so she was on board with working one-on-one with a sound healer, and I gave her a referral to a sound healer. And look, some patients might go, oh God, you go and see a fertility doctor and then they're suddenly giving you referrals to a sound healer?
You're a special one, Dr. Tash, which is amazing because,
well, some people don't see it that way. I thank you for saying that. But some people see that as like, oh, what the hell? But I'm like, yeah, well, actually, it's about your healing. It's about your healing. It's about you wanting to be pregnant in the future, and about me avoiding you needing IVF treatment.
But treating what's present now. I mean, the IVF, like I said, trauma is a big one in what I do in terms of my coaching. If they've had miscarriages, if they've had inner child trauma, if they've had, even child trauma wounds from parents and a lot of stress growing up with, maybe divorce, all of that is all sitting in the body. So a lot of the stuff is highly unconscious that we're not aware of, that all that trauma, if you go back to their history, what happened between 0 and 7, they're struggling with years and years of other stresses now. It's like, what was happening in your childhood between that time? And if you can find trauma, if there's anything that happened that was a significant event, all of that sits in the body. We are emotional beings, but if we've got negative emotions such as anger, sadness, fear, hurt, and guilt, that sits in the body and that prevents energy. So you could be doing 10, 20 cycles of IVF, but trying for 10 years to get pregnant. If that doesn't move, and the root chakra, like talking about, you're very holistic, the root chakra, all of that, which is conception, the root and the sacral chakras, which have to do with reproduction. If that's blocked and the energy is just all sitting there and, the aura is not good and nothing's moving, it's not going to happen, right? It starts with moving that energy, the emotion, and having that frequency. We're such good conductors of sound. I love sound. I do sound myself in clinic, and it moves so nicely. And, the best thing is you at
Yeah, you
least feel good.
tuning forks.
I do
Tuning
tuning
forks.
forks. Yeah, yeah. I do
Forks
sound
are
bars as well. We do tuning forks on you. Yeah.
amazing. I mean, tuning forks are such a subtle way of resetting things. It's just incredible.
And they're amazing for kids. I use them on kids who don't want acupuncture. We use them on specific points because a lot of the kids are having ADHD, all of that that's all stress in the body that's pent up. But if you can relax their nervous system, they're completely different people. But
Mm,
yes, sound healing, emotional healing, because all of that addresses the deeper emotional aspects. And it all
mm,
comes down to emotions, I find, right? Because that's the initial driver, which then causes the body to be stressed, and then it leads to all of the poor habits that we're
mm,
coming from. And it's not just one person. A lot of the time, the men have a lot of inner child trauma, a lot of abuse, a lot of that needs to be addressed. So it could be, the male, which is a weak link in that fertility
mm.
partnership as well. So need to address both people, I think, holistically. And then when you clear that, it's not only from a energetic perspective, but then then the child that you're bringing to the world, from my experience and from the research, they're not carrying all of this intergenerational trauma with them, which is a whole new topic we can talk about next time. But yes, it's important that they're looking at what are they carrying, what they need to sort of work through before starting a family as well, right? And so that's important that they've addressed all those issues.
Yep,
Yeah, yeah,
absolutely.
amazing. So just going back to, I guess, with the IVF and with the endometrial, another thing that is important is sort of the endometrial receptivity. What actually makes like an endometrium more receptive, and how important is that we're sort of like, I guess, the soil for the body, and to improve that sort of IVF outcome with the endometrium and implantation success?
Well, we don't really understand the endometrium very well. We think we do, but we don't really. There's lots of unknowns, which is why I
Mm,
100% successful, even with normal tested, typically normal embryos.
yeah,
But yeah, the endometrium has to be receptive. And what does that mean? It has to have receptors, progesterone receptors that will acknowledge that there is an embryo in there in the uterus and want it to implant. And obviously, there are progesterone resistant conditions like endometriosis, for example, that can make that more difficult. Inflammation in the lining of the uterus, endometritis due to infection can also impact on implantation. Immune issues, blood flow issues, where you come in as well as with your acupuncture.
yeah,
So, endometrial receptivity and again, there's lots of unknowns. There are
yeah,
really we speculate a lot of potential treatments. A lot of them are the immune ones are more controversial, like the NK cells, for example, was the majority. And if you look at the data and most of the evidence, there's no great evidence for steroids and NK cells. We have heated discussions at fertility meetings about natural killer cells and steroids.
yeah.
Majority of the doctors at these meetings think it's BS. And then you've got some other doctors that feel that there's actually quite a lot of information that we can base that on. And so yeah, I'm kind of very much on the fence with that. And again, I prefer to go back to basics and help fine tune things with the patient rather than throwing drugs at them like steroids. Like,
Mm,
yeah, I would recommend that a patient see an acupuncturist and have
mm,
acupuncture before I give them Clexane and aspirin for endometrial
yeah,
flow. Or we can do it together. Add
yeah,
in add in acupuncture because there's no evidence of harm, and then if need, add in those drugs with potential side effects, and costs. That's the thing, right?
yeah.
Acupuncture has so many whole body benefits. Huge. What are the risk factors? You tell me. What are the risk
Yeah,
factors?
hardly any. Look, it might be a bruising, right? But that's about it, really. If you go to a qualified acupuncturist that is working with understanding, especially around IVF and conception and reproduction, they've known in Eastern medicine how the uterus. I mean, they knew a lot more than lot of Western society and the doctors. Like they've known so many things without what they have in science today. They knew more about the body than I think some Western doctors know, right? With much more limited information. And so, yeah, where a lot of the blood flows to the uterus, right? With the acupuncture, there's certain points which are uterine points. It just improves a lot of that blood flow to the area, which I've seen. And even from all the studies they've done now with a lot of the acupuncture before and after IVF, definitely improves a lot of that outcome, right? You're first of all, the stress, you're reducing the stress in the body, which is huge, right, for people going through the IVF process. But when there's better blood flow, there's reduced inflammation to the area, everything's flowing better, you definitely have a better outcome. So it's all about blood flow, energy flow. And like we were talking about earlier, when there's stuck energy, nothing is going to move, right? Stop the implant, there's just a lot, the energy's not moving like it should. When things can move better, you're going to feel better. When you feel better, things are going to, work optimally, right? That's essentially what you want at the end of the day. So the acupuncture just helps move the energy where there's blocked energy and on certain points. So usually when they come in before the transfer, we're doing a lot of lower abdominal points. And then after the IVF, we do a lot of head points and a lot of distal points to really improve sort of that stress response and the implantation of the uterus. And then following them 3 to 5 days later, depending on if it's a 3 or 5 day embryo, to help with the implantation, again, is going to improve some of that receptivity implantation, because that the flow to the uterus is going to be better, or you're sort of helping that energy to move, and so it's not stuck, right? Anything you can do to move that energy is going to improve any sort of outcome, I find.
But language of energy, you're not really talking about conventional. You're not talking in conventional terms, which usually throws people.
Yeah. It's blood flow as well as moving the chi, right? So chi is essentially energy. We have meridians, we have energy that is needing to function, throughout the whole nervous system. So it's a mix of both moving the blood flow, the energy, as well as, making sure that things are just flowing better, and you're reducing stress in that nervous system as well. So essentially, it's a combination of all those things. Yeah.
I hear.
So anything we can do to help, improve that flow. Some people, look, I said that the only difference I did to some of these successful cycles was to add in acupuncture to the rounds. They may have found me later. And before that, I just found it just wasn't anything we can do. I think in some of the studies, it's been shown that even just adding the acupuncture can improve your chances by 60 to 70% in a sort of pregnancy outcomes. Look, I think anything we can do to help improve that is going to be better for the patient for sure.
Yeah, and I think it's just keeping an open mind is important, both as the doctor and as the clinician, both as the Eastern practitioner and the patient, the treating practitioner and the patient. I feel they need to have open minds.
Yes.
Without an open mind, you're going to struggle in life, whether it's baby making, general happiness, balance.
Yeah, I agree.
Keep that open mind, which is difficult because, again, it goes back to childhood, doesn't it?
Yes.
Depending on your environment and how you've been brought up. Some
It
people,
is, yeah.
They can't help but be very narrow-minded and closed-minded. How do you teach that? And the same comes with fertility treatments. Yeah, why don't you consider this? It's not your conventional, but give it a crack. When I say that, I mean more the holistic stuff that comes outside of the routine IVF protocols. Like when we're giving patients drugs and doing things to their bodies like that and getting them to spend all this money and self-inject. Yeah, you know what? You do want evidence for that. I'm sorry, you do. I want to see the evidence. Where is the evidence for this drug helping you conceive? Because that drug can have not only a negative impact on you now, but in the future, but also any developing embryo and then that child in the future.
Yes. Yeah. We don't know that, right? Yeah. How that can affect them in 10, 20 years time. Because
it's and asking the patient what they're comfortable doing. And I'm giving them the information. Yeah, go away and listen to this podcast. See how you resonate with that. If you don't do it. If you don't resonate with it, don't do it.
Yeah, agreed.
Like hypnotherapy, for example, for traumas, phobias, we know works very well for smoking cessation.
Yes, I do a lot for the quit smoking and the vaping. I'm like, look, if you're going to have a baby, the day you quit smoking, then we're working on your health after that, right? And that's a big setback that I find with the men who can be a bit stubborn out there, right? It's like, if you really want a child, if the woman is sacrificing everything and she's doing so much, it's how badly do you want a child, right? I think if a couple is willing to do whatever it takes, which is what I see in terms of, good outcomes, if they're willing to do everything they take that they can to get healthy, they're going to see the outcome. But if they're stubborn, they're not wanting to change their ways, well then, that's expected. So it's a tough conversation, but it's how badly do you want to have a baby at the end of the day, and a healthy baby. It's nothing worse than having issues later with an unhealthy baby, which is like a preconception care we talked about is so important, that what we're doing is going to influence, their health afterwards. Because I read somewhere that what you do in the 2 years prior, in this study, 2 years prior to conception affects their the genetics. So it's not just even the 3 months now. It's as far as a good
3
year.
months is not enough.
No.
Yeah, minimum of 1 year.
Yeah,
Yeah,
definitely.
which is why it's always about forward planning. But what's your vision board look like for your life? Have you ever done a vision board for your
Mm,
life?
mm.
Did children come into that? And if
You want-
so, where you factor in when that will be and what changes you need to make in the lead up to.
Yeah.
Yeah.
Yeah, exactly. So look, if you could change one thing about how couples approach IVF, what would that be?
The mindset coming into it
Mm.
and being prepared to slow down and to make changes to enable them to make those changes, which will, if you're prepared to slow down, you will be able to manage stress better. You won't be in so much of a rush, which in itself will increase your cortisol and stress levels. So I would encourage people the mindset needs to change.
Yeah. So is that your advice for optimizing IVF and conception success in 2026 and beyond?
Sorry, say that again.
I said, is that your advice for optimizing, IVF and conception success in
Yeah, you could
2026?
say that. Yeah,
Mm,
that's a
yeah.
good mantra to keep in mind. Slow down.
Yeah. We're so rushed all the time. Because when we
Mm.
slow down, our nervous system slows down, right? So going back to those practices, like taking time and maybe doing more meditation, journaling, trying different things that are going to help you to slow down is when we're rushed, where it's just, yeah, we become more stressed, right? And it's just the day and age we live in. So slowing down there's a saying, I think it's slow down to move forward, something like that. But
I
yeah,
like that. Yeah,
yeah, we need to slow down to move forward. Otherwise, we just keep running in circles, really.
exactly right.
Amazing. And look, we could talk for ages, Dr. Tash, but thank you so much for sharing your wisdom, insights, and your holistic approach to IVF success. I think it's much needed because there are couples that are going through so many cycles, and if we can help those people to understand that, yeah, it shouldn't. All that preparation is going to help you to really improve your next IVF outcome, or to take a step back and look at the root cause and what's really going on. Because I find there's no such thing as unexplained infertility, like you said. It's just finding the root cause, addressing that, and then giving your body time, right? Sometimes we do just have to allow the body to do its healing, and that takes as long as it takes.
Exactly. Well,
Yeah.
thanks for the chat.
Thank you so much, Dr. Tash. We'll have to get you back on a later podcast. There's so many episodes, so many topics, I guess, that we can chat about, because I love your holistic approach. And, I think working with holistic doctors, and it's a team, I think the best outcome you can get, because like you said, we can't do it all, but if we have a team of people that we can make sure we put the clients first, they're going to have the best results. So I'm going to put a link to Dr. Tash's details. So if you want to contact her, please, go see Dr. Tash. But yeah, thank you so much for your time today, Dr. Tash, and we'll speak to you very soon.
Thank you.
Thank you. Thank you for tuning in to the Holistic Health and Hormones podcast. I hope this episode has helped you see IVF through a new lens, not as something that's happening to you, but as a process you can actively support, optimize, and move through with confidence. IVF success is never just about the protocol, it's about the preparation. So if you're listening to this and you're preparing for IVF, navigating failed cycles, or simply wanting to give yourself the best possible chance of a healthy pregnancy, know that support exists and that there are steps you can take to optimize your body before, during, and after IVF. If you'd like personal guidance on how to prepare your body for IVF or conception, you can connect with me. Thank you for tuning in, for trusting this space, and for honoring your path to parenthood. Until next time, take care of your health and